Well, I would like to start with an apology and say we're really sorry for what happened. I recognise that with this tragic incident, 2 families have been devastated. So I want to extend my condolences to the Locke family and my apology for the care that we provided to Matthew, to the Daley family.
What went wrong with Matthew's care?
Well, when we've looked back on Matthew's care, we would believe that our team worked very hard to provide good care to Matthew, but there were a number of areas that we felt could have been improved. One is a formal diagnosis for Matthew. The second is that we should have listened more closely to the family and acted on some of what they said to us. And the third area is that there are aspects during the long time that Matthew was with our team when they may have considered taking a different type of treatment for Matthew.
Those are the failures you've identified. What explains why they happened?
Well, when we've looked at this in more detail, obviously our teams work very hard to provide the best care they can. And in a case like Matthew's, where Matthew first became known to the service in 2008, over a very long period of time, the team believed that they were treating Matthew for the right conditions. And really the learning from this is to ensure that over that long period of time and the relationship, the close relationship that teams form with their patients, is to ensure that they consider other forms of treatment that might be appropriate.
It does seem a pretty fundamental failure to diagnose, failure to listen, and failure to change when circumstances change. There isn't much more you're meant to be doing.
Yeah, well, I mean, it's a very complex balance that our teams have to consider in relation to ensuring that they're treating patients in the right way. In the case of Matthew, obviously Matthew's an adult, and our team had to consider in their interaction with Matthew what was the best form of treatment they could give him, and listen to the input from others, including his family, and decide based on their clinical expertise what was the best treatment for Matthew. In this case, we believe that they should have further considered other aspects of care for Matthew.
For a mother and father to beg for their own son to be locked up, that's a powerful message from a family that was ignored.
It was a very powerful message. Now, our team at times did consider whether a mental health act was appropriate, but did not follow through with that, because they believed that they were treating Matthew for Asperger's, and his primary condition was Asperger's rather than psychosis, and they believed that was the proper form of care. But yes, you're right, I can understand from the family how frustrated they must have felt in the context of asking for that to happen, and then the tragic events that have happened.
This isn't the first time you have had to learn from a homicide. You had 2 previous cases in 2010. You were criticised then for having risk assessments that were a tick box process. In 2012, one patient murdered another, and Caden Smith, the murderer's mother, said she had vital information about his violence and paranoia which was not taken into account. You were meant to learn then. In 2016, we're seeing the same mistakes.
Yeah, and that's not acceptable. And it's not acceptable for us as an organisation going forward. And we'll take full responsibility for that to ensure that we do learn the lessons as we move forward.
But that's what people always say. We'll learn the lessons, and the evidence suggests it never happens.
Yeah, well, I wouldn't say it never happens, and I can understand the cases that you've referred to. But we see this case as one that we will ensure we learn for the future.
Just looking at more recent reports about your trust, the CQC says at the moment you're failing with your target to share learning from serious incidents. Less than 1/5 of the reports about serious incidents are signed off on time. You score poorly for staff training. How well do you rate yourself at the moment?
Well, CQC will be coming back to carry out another comprehensive inspection in September. We believe we've made considerable improvements since their last inspection, and those improvements we believe will be evident when CQC come back to inspect us. We have improved our incident reporting. The number of incidents that are now reported have increased, and we have ensured that we've introduced different and new ways of learning from our serious incidents when they do occur.
Do you want to give an example of that? I mean, how are things changes with regard to serious incidents?
Well, we now have a newsletter which we circulate to all staff, which is Learning from Serious Incidents is the name of the newsletter. We also have held a number of staff workshops across our organisation, and we've held a learning event which brought all our staff, 300 or 400 of our staff together, again to learn from serious incidents. We've also redesigned how we deliver services locally with what we call our care delivery services. And our care delivery services involve our clinicians and managers working very closely together. And serious incident and incident learning is a big element of how they take forward their work.
You've also got an elevated risk at the moment for discharging people without a recorded crisis plan. How do you know there isn't another Matthew Daley in those people who you are not recording a crisis plan for?
Well, we've taken forward improvement work in relation to our crisis planning, and in fact we are now improving that right across the trust in terms of ensuring that people discharged from our care do have a crisis plan. In relation to whether or not there's another Matthew Daley, I would like to say that these incidents are quite rare, and I would like to reassure your viewers that the vast majority of care that we do provide is good care, but there's no guarantee that incidents like this won't happen again. What we need to do is ensure that we learn the lessons from what has happened and try to ensure that they're fewer rather than more in future.
You are not alone in failing to be able to meet these targets, to assess people to the levels that are expected. What explains why these services aren't better run, not only for yourself but elsewhere?
Well, what I would say to you is generally within the NHS and actually within the health service globally, learning lessons is one of the areas that lots of health services are trying to improve. And when you think that within the health service we are really dependent on our people, and as humans we make mistakes. And what's incredibly important is that we learn from those mistakes for the future rather than blaming our staff for what has gone wrong.
So it isn't about money, it's about leadership, it's about training, it's about management.
It is. It's about leadership, training, it's about culture. It's also about resources as well, of course, in the longer term. But actually, if we have the right culture and the right behaviours and relationships within our organisation, it will have much more of an impact than additional resource. Is the problem with the culture that the experts still think they know best and they'll dismiss what the families say? No, that's too generalist. That can happen, and in this case we believe there was an element of that, but that's not always the case. And there are some tremendous examples where we have co-design and co-planning of care for our patients with our professionals. So it would be wrong to think that that's something which happens all the time.
I'm quite happy. Oh, just one more point. I mean, well, two more points actually. First of all, don't you have a duty to be safe rather than sorry? In this case, for example, shouldn't Matthew have been detained?
Well, and again, that's our teams make very difficult and complex decisions every day, and one of those is to consider whether someone should be detained, which means they're deprived of their liberty, and our teams have to consider very carefully as to whether or not that's the right course of action. Our teams in this case decided not to detain Matthew. They may have taken a different decision, and in terms of some of the information they have, you could argue that they should have taken a different decision. I'm not a clinician, so I can't second guess our clinicians in terms of the decision they made. But you could make an argument that Matthew should have been detained. But what I would say is that when we do detain someone within our care, it's for a limited period of time. It's not that their liberty is deprived for a very long period of time, because we have to be very careful about how we deprive people of their liberty. So they would be brought into our service for a short period of time, and then they obviously appropriately would be back in the community, living in the community again.
Every time something like this happens, it puts back the progress made to get rid of the stigma of mental illness.
Yeah, and that's something which I would be passionate about. I would want to say to your viewers that they should not judge mental health services by these individual incidents. Actually, our staff work every day with thousands of patients and provide really good care.